Hello everyone, welcome to today's podcast. I'm Dr. Mahesh. I'm the lead anesthesiologist at Rainbow Children's Hospital, Bannerghatta Road, Bangalore. 3 decades as an anesthesiologist, I have been witness to a wide range of cutting-edge innovations happening in the field of gynecological surgery. I'm thrilled and indeed honored to have amongst us an inspirational doctor who has a constant childlike enthusiasm to absorb and explore newer cutting-edge technologies. Dr. Shailaja N has been an enigma I am yet to decipher. I frequently complain to her that the God has given her 36 hours in a day.
Today's discussion will revolve around natural orifice transluminal endoscopic surgeries. We all know that oral, rectal and vaginal node surgeries are in vogue of late.
Madam, this scarless innovation is going to create ripples in the field of gynecological surgery. I would like to start by asking you, what drove you to adopt or pioneer the vaginal nodes approach for hysterectomy? What were you trying to solve?
So thank you so much, sir. I'm Dr. Shailaja, so obstetrician and gynecologist at Rainbow Children's Hospital, Bannerghatta Road, Bangalore. So I am really blessed to hear such wonderful words. It is indeed a blessing. He is my guiding force, I can say, in Rainbow Children's Hospital. So thank you so much, sir.
Welcome.
So I would like to start with V-nodes, how I got inspired. See, basically I'm a vaginal surgeon, very passionate about it. I learned my vaginal surgeries from my great teacher, Dr. L. Krishna, Dr. Shyam Sundar Bhatt. So I was really inspired by their surgeries. I started doing my vaginal surgeries. Icing on the cake was learning non-descent vaginal hysterectomy from Dr. Piley. So after that, I moved on to learn laparoscopy. So in my practice, I started doing more of laparoscopies than vaginal surgeries because that is how the practice is. So, but my interest in vaginal surgeries never died. So once when my close friend in Mumbai gave me information about this V-nodes, that is vaginal natural orifice transluminal endoscopic surgery. The training program was in Jalgaon by Dr. Suyash Nawal. So when I wanted to go for this training, many of our colleagues actually discouraged because we were doing wonderfully laparoscopy, vaginal surgeries also. So we did not actually find the need for this. But even then, I pushed myself to learn this procedure. But after going there, it really transformed my practice. I fell in love with the technique. So because this V-nodes is a combination of vaginal access surgery plus the laparoscopic endoscopic visualization. So that gave me real push. It is, I can say, paradigm shift in the gynec surgery, this V-nodes.
From a patient's perspective, what was the perceived advantages that you were trying to give your patient through V-nodes approach?
So actually, I chose this V-nodes mainly for the patient purpose only because the patient outcome is really great in this technique. So when I saw in Jalgaon, he operated in 2 days, almost about 8 cases. So when we saw the patient outcome, when they were in another 6 to 8 hours, they were so comfortable getting up, walking around. They didn't even feel like having a surgery. So that actually enthused me to take up this. Till now, I've already done about 8 cases. In my 8 cases also, I noticed this. So one of the patient told, Madam, I'm not feeling I have undergone the surgery. In case I forget the surgery and do something, strenuous work, so will it affect my surgical scar?
The same thing we observed when we transitioned from abdominal hysterectomies to total laparoscopic hysterectomies or laparoscopic assisted vaginal hysterectomy. So you mean to say from total laparoscopic hysterectomy, the V-nodes outcome is far superior.
Yes, sir. Definitely. Because in my beginning of the practice, when I shifted from abdominal surgeries to laparoscopy, I felt this. And patients were very comfortable when we went for the post-operative rounds. So, but this is little more advanced than that. See, evidence also says this actually when they compared the conventional laparoscopic surgeries with the V nodes, the post-operative pain, the requirement of analgesia, they're getting back to their routine work, everything is faster in the V nodes compared to the traditional laparoscopy.
Excellent. From a surgical perspective, how critical is patient positioning? What amount of carbon dioxide insufflation you will need? What about the blood loss and post-anesthetic pain management when compared to total laparoscopic hysterectomy?
Yes, sir. So when compared to conventional laparoscopy, the Trendelenburg which is required is very minimal in V nodes.
Okay.
So that is why obese people with comorbidities who have got
In those
cardiorespiratory,
where we cannot give a steep
Yes, sir.
Trendelenburg position that is
Yes.
required for TLH.
Yes, the less cardiopulmonary strain will be there in V nodes. And also the pressure, insufflation pressure is hardly about 10 to 12 millimeters of mercury.
We always have up to 14 to 16 sometimes
Yes.
in total laparoscopic
Yes, sir.
hysterectomies.
So that is one advantage in V nodes. And also like the pneumoperitoneum, the pelvic cavity is very small. So carbon dioxide absorption is very minimal. And also we are not stretching the entire abdomen here. Only the pelvis we are operating. So peritoneal stretch is also minimal. So post-operative pain is less because of that. Less peritoneal stretch and less carbon dioxide absorption. And also the shoulder tip pain is very minimal following V nodes compared to laparoscopy.
Obviously. What about the suturing part?
Suturing
Closing the colpotomy that you have done. Do we do it endoscopically, or you remove all these gadgets and then do it like how a vaginal surgeon sutures the...
Usually suturing is done by open techniques. We take out all the retractors and nicely, see already we would have taken the uterosacral. That suture will come out through the vaginal wall. So that anchoring of the vaginal vault to the uterosacral happens and we suture it by an open technique.